Good morning. I'm really excited to bring to you our next special guest here on the Youth Veterinarian Initiative, which we fondly call YVI, with my co-host, Dr. Monique Wells out of Paris, France. And now, before we proceed, I want to get back over to I've been looking at the ferrets that we've been talking about, and I've got to go back over to, so I can introduce our esteemed guest. Dr. Athema Etzioni is a board-certified veterinary clinical pathologist. She was homeschooled and entered college at Xavier University of Louisiana at New Orleans in the spring of 1994 and received her BS degree in biology pre-medicine with a chemistry minor in spring 1997. That fall, she was accepted into Tuskegee University College of Veterinary Medicine, Nursing and Allied Health, now College of Veterinary Medicine, which is TUCVM. At the tender age of 24, she received her doctorate of veterinary medicine in May 2001 and went on to complete a veterinarian clinical pathology internship in the Department of Pathobiology in May 2002. Dr. Etzioni she completed a residency and master's degree in veterinary clinical pathology at Purdue University School of Veterinary Medicine in the fall of 2005. Since then, she has worked in the shelter, research, academia, government, corporate, and private practice sectors of veterinary medicine. In October 2015, she rejoined the faculty of TUCVM, and that's Tuskegee, Alabama, and currently serves as associate professor and section chief of veterinary clinical pathology there. She's also the director of clinical pathology at the Center for Integrative Veterinary Medicine, and that's in Alexandria, Virginia. She's an associate veterinarian at South College Veterinary Clinic in Auburn, Alabama, and a relief small animal veterinarian who is USDA accredited and licensed to practice veterinary medicine and surgery in Georgia and Alabama. Now, personally, Dr. Etzioni's husband, I'll get it, is married to Dr. Baruch.
He's not doctor, it's just Baruch Etzioni.
Yeah, a wonderful husband, Baruch. The couple has 4 beautiful children. Okay. I didn't even ask the name of your daughters. Please name them.
I will say them for you. It's fine. So, son, Akibalon Etzioni, and 3 daughters, Naila, Zaria, and Iman. And then we have 6 fur babies. And that includes 2 German Shepherds, Peachy and Perry. And we also have a Great Dane. Sorry, the Great Dane is Perry. And then Peachy and Gus are the 2 German Shepherds. And then we have 3 ferrets, Brown Sugar, Ivory, and Pepper. Pepper's the girl, and the other 2 are boys. And then with the dogs, Peachy's the girl, and the other 2 are boys. So.
Okay.
Incredible. That's a huge household.
Thank you, Athema, for being with us today. And I'm so excited about what you have to share with our community.
I'm excited as well. And thank you both for having me. It is an honor to be in this group and to, be asked to give this presentation. Initially, I was to speak with the students on veterinary medicine and then give answers to some questions that were posed by the 6th graders. But the questions were so good and plentiful that I made the presentation from the questions that were asked. So here we go. Questions from 6th grade.
All right.
All right. So Tuskegee University College of Veterinary Medicine is where I am. And I actually got my DVM, as Ms. Sharita said. And it's, been such a excellent, field. And it's allowed me to do so many different things in not just veterinary medicine, human medicine world as well. So, one of our alumni said that we're not just veterinarians, we're not just pathologists, we're scientists. And so if we look at ourselves in that aspect, it broadens the view of what the possibilities are. So as we see here, we have people from all over the place. All right, so my field,
Now,
my journey.
just really quick, where are you originally from?
I am from New Orleans, Louisiana.
Okay.
And,
Okay.
Born and raised both sides of my family, New Orleans, Louisiana. And, I only migrated to Tuskegee for veterinary school and then wound up finding my husband here. So that's why we kind of settled in.
Okay.
Yeah. The experience that I had throughout my career, I'm going to just briefly go over it and just encourage you guys to have experience in a variety of areas so that you can actually say, oh, I like this or I don't like this based on your own experience instead of going by somebody else saying, oh, I didn't like that. You're not going to like that. You want to get your own experience. So I had pet spiders and cats growing up. So I thought I wanted to be a cat practitioner. Then when I actually worked in a small animal practice, I was like, I don't know if this is for me. And then I worked in the zoo. I was on Discovery Walk telling people about the little pocket pets and things that you can get, in the pet store. And, that was like so awesome. I was like, I want to be a zoo vet. And then I got to vet school and I was like, oh, I like clinical pathology. I can do this as a career. And, so I specialized in the clinical pathology and I was a little older, so didn't go back to do the zoo med, but I love the zoo med. And I realized you have to be, you have to wait for somebody to die or retire to get a position as a zoo vet. So, all zoos don't have, veterinarians. So there's not that many positions open there. But during vet school, I went to different places during each summer. The SPCA was where I did volunteer work before I got to vet school. And then I did that first summer out of vet school. Then I went to the CDC, worked in parasitology, and that was the government. And then the next summer, third year, I did the corporate, which was also pharmaceutical, Pfizer Animal Health. And that was actually a desk job, but it was really exciting. And, after vet school, we already heard all of that stuff, so I won't bore you guys with all of that, but I decided to keep clinical pathology as my main career, but I still do private practice. And what we see in these pictures over here are heartworms. These are called microfilaria, and this is something that can be in dogs if you don't have them on prevention. And,
So Athema, before you advance, can we just go back to that slide for a second?
Okay.
Okay, so for everybody, the image that sort of slanted, it looks like a slash mark, and it's got a lot of little dots on it, and then it's got two big squiggles down the middle. So the squiggles are the heartworms, and the little dots are the blood cells, the red blood cells. Yes. And so, Athema, I would just like for you, before we go on, because you are a clinical pathologist, to tell us just what that is. I know you'll go into it in more detail, but just to paint that broad picture for us right now.
Okay. So as Monique said, these are the heartworms, these purple kind of winding things. There's two on this slide. And surrounding them in the background, we see some pink cells. These are called red blood cells. And these are the cells that carry oxygen to your tissues. So as long as you have enough red cells, then your tissues get, enough oxygen and you can move around and have, normal amounts of energy and so forth. If you have anemia, which we'll talk about a little bit later, meaning you don't have enough red cells, then you won't have enough oxygen in your tissues, and then you can be really tired a lot. So if you're really, really, really tired and you can't find the energy to just get up and do what you need to do, then you may, need to go get your self-checked out and make sure that you have normal cell numbers to carry the oxygen to your tissues. We also have white cells. Here's a little smiley face right here. So this is a white cell called a neutrophil, and this is a white cell called a lymphocyte. And these over here are all white blood cells as well. The neutrophil is called a neutrophil because it has a kind of clear cytoplasm. The cytoplasm is the kind of liquid part of the cell, and then the nucleus is this purple part that you see. The nucleus is what tells the cell what to do, and we have cells in our body as well, so just different kinds of cells. We also have red blood cells, white blood cells, and then there are some platelets here in the background, these little bitty tiny little dots, and the platelets are what stops you from bleeding when you cut yourself. So like if you mistakenly cut yourself and then you start bleeding at a very quick point, within a couple of minutes, your blood should stop, bleeding from that area, especially if you apply pressure to help your body start the clotting process from that area so that you don't continue to bleed. And so, if we do have trauma, which, sometimes unfortunate things happen, we want to make sure that our body is able to stop us from bleeding so that we, can live. And these other white blood cells here are eosinophils. And as you can see, the cytoplasm is a little pinker or orange because they have granules in them. And these eosinophils come out because we have these parasites. They come out with worms, wheezes, and weird diseases. So worms, just parasites in general, including heartworms, fleas, ticks, and, intestinal worms. And, wheezes would be things like asthma, allergies. And, some people have allergies to pollen. Some people have allergies to peanuts. And so, if we get these allergens in our bodies, then we'll get this response from these eosinophils. And then our lymphocytes that we have here, this is a cell that can transform and become what we call an immune cell and, produce antibodies against things that our body has, been exposed to before. And so if you get exposed to it again, then you can protect yourself. Now we're talking about coronavirus. If you're, exposed to coronavirus and you get ill, your body is making antibodies. And for a short period of time, those antibodies will mount a response against the coronavirus if you get exposed to it again within, I think they said a few months. But we're going to have a long presentation, so we're going to try to kind of move a little bit swiftly. But, I'll be definitely open for questions if we have questions after the, questions can be sent to Ms. Monique or her organization so that I can address them. And again, thank you guys for this opportunity. So without further ado, let's get into the questions. Right. And these are directly stated questions. I didn't change them at all. All right, so first question is, are there some fluids that you can find in animals that can also be found in humans? So we are exactly alike in a lot of ways, physiologically, physically, and mentally, really. And then some animals have learned to talk. So you might find YouTube videos or TikToks that, have dogs that say, "Ah, woo, woo," saying that they love us. We know there's a lot of birds such as macaws and African grays that can actually speak. So, I haven't had a pet bird, but I've worked with them and, they're very funny because they not only pick up the good words, but they can pick up some not so good words as well. And strangely enough, they use them at the right time. All right, so all of the fluids that I know of in most animals, especially we'll talk about mammals. We are mammals. So we have hair, we have, we give milk to our young. We have joints. Joints are moving parts. So our elbows, our, knuckles, knees, hips, these are areas that move to help us get around, help us, pick up things. And that joint fluid has to be present in a small amount. If you injure your joint, then you can have an increased amount of that joint fluid produced, and that can cause you to be painful. You can have inflammation, which is another thing that can cause you to be painful. If you damage your joints, then you can have what's called lameness, which is trouble walking around. Cerebral spinal fluid, this is that liquid that's surrounding your brain and surrounding your spinal cord. Your brain and your spinal cord are your central nervous system. We also have a peripheral nervous system, which includes all the sensory nerves and the motor nerves. That the sensory are helping you feel things and the motor nerves are helping you respond to them. So say, for instance, if you have a hot pot on the stove and you touch that hot pot, there are sensory nerves that send signals up to your brain through your spinal cord from these peripheral nerves that say, "This is hot, you need to move your hand." So then you move your hand, and that motor action is from another set of nerves that came back and said, yes, let's move our hand because we don't want to continue getting burned. Peritoneal fluid is abdominal fluid, or the fluid that just kind of washes the organs in the abdomen. So it's not a lot of fluid, but it's just enough that your organs are not sticking together. Because realize your intestines, they move. Your intestines move to move the food that you eat throughout. And then, of course, at the other end, we get things that are called waste products. And so if we didn't have this peritoneal fluid, those waste products would have trouble getting through the intestine because it wouldn't be able to move as readily as it should. Pericardial fluid, we have a heart, and that heart beats in our chest. And that heart needs to expand and contract, expand and contract. And while it's expanding and contracting, it's giving blood with oxygen in those red cells to the body organs throughout your system, including your brain, because you need blood in your brain to get oxygen in your brain. And so if we didn't have the pericardial fluid, then of course our heart wouldn't be able to freely contract and relax. It would stick to the sac that it's in. And you know, if our heart doesn't beat, then we don't get blood to our organs, oxygen to our organs, and we can't live. Pleural fluid is the fluid that's in the chest cavity. The chest cavity is where your lungs are. So again, your lungs need to expand to bring oxygen in. Breathe in, breathe out. So you breathe in to bring oxygen into your lungs and you breathe out to blow off CO2. That CO2 is carbon dioxide. And that carbon dioxide is waste as well. So we have waste that comes from the respiratory tract, and we have waste that goes from the intestinal tract. Okay. All right. So next we have a complex question. Complex because it can't be answered in one slide. So I have several slides that will explain that. So if an animal had too much of one cell type, is there a way that you can give the animal just the blood cells that it needs? So if the animal has too many blood cells, then we may not be able to take away those cells, but there are some conditions where we don't have enough cells where we can give those animals just that one cell type. So polycythemia is when we have too many red blood cells. So remember I told you oxygen is what red cells carry to your tissues. But in this particular illness, we have too many red cells and we're producing more and more red cells, but we can produce too many red cells to the point where not only do we have all of these cells, but if the blood is too thick with red blood cells, then the blood is too thick to go to smaller blood ways to get to the organs to give the oxygen. So too much is sometimes not good. You know, in moderation, we say. So you want to have a normal number of red cells, not too many red cells, because you don't want your blood to be so thick that the blood can't get to the areas that they need to get to. So in the case of polycythemia, we call it polycythemia vera, they actually do what's called bleeding that patient. So they'll actually stick a needle in the vein, which is one of the vessels that the blood travels through to go back to the heart, to the deoxygenated blood or blood that doesn't have the oxygen in it. So they're not taking the blood that has the oxygen in it. And they pull out a certain amount of blood and then replace it with saline, which is, you know, fluid that's normally in our body, so that the blood can be a little more fluid so that the animal can be normal as far as oxygen. So that is something that we need to be aware of.
So is that what's happening in that picture? I was trying to
So here we have a dog, and this is the muzzle of the dog, and we're lifting the lip to show you that the mucous membranes are really, really red. So usually it should be a pink color. And I'm sorry, I don't have a normal to compare it to, but this is actually, it would be more compared to the color of the person's finger that's holding this particular patient's lip. But we can see it's really, really red and engorged with blood. And that's because this patient is polycythemic. Okay. All right. So just to compare it, even in a busy city, we have lots of people, but these people can freely walk from point A to point B. And there's no impedance. Impedance is when there's something stopping you from being able to move freely. And so this is when we have a normal flow of blood, like the people walking in the street. Polycythemia would be compared to a busy concert. And we can see that these people are packed so densely that they can't like move from one place to another as quickly as we would be if we had a normal number of blood cells within the fluid called blood. And so this is a part of our circulatory system. And if we get to this point, such as in this picture to the right, where these people are at a concert, they're just kind of at a standstill and can't go from one place to another. And so think about that in terms of the red cells can't get to your organs in order to give you oxygen to your tissues. So normal, steady flow of people, steady flow of blood cells. Not so good, polycythemia, blood is too thick to travel where it needs to travel to get oxygen to your tissues. All right. Leukemia is too many white cells. So remember on that first view, we had pictures of red blood cells, white blood cells, and platelets. So we still have red blood cells, white blood cells, and platelets, but the white blood cells we see are the wrong kind of white blood cells. So this is too many of this kind of immature white blood cell so that we don't have enough of the normal white blood cells. So this cell down here is a neutrophil. And this neutrophil is what we would like to have as a predominant cell type in the dog and in the human. There are some animals that have a predominance of lymphocytes, but these lymphocytes, or should I say these round cells, are a lot bigger than our lymphocytes should be. Our lymphocytes should be smaller than this neutrophil. But as we can see, all of these cells are much bigger than the neutrophil. And so these cells being too many of these immature cells because they're large, they have these, variably sized and shaped nuclei, and active cells have this really blue cytoplasm. So we can see that bluer cytoplasm. This is called leukemia. So the leukemia can be of any cell type. This is in the white blood cell line, but you can have leukemias that affect the red cell line. You can have leukemias that affect megakaryocytes, which are platelet, give rise to our platelets. So in this particular case, when we have too many cells, sometimes they'll give medications to try to kill the cells so that they go back to being in normal numbers. But the medication is to stop rapidly dividing cells, but it doesn't just affect these blood cells. It also affects blood cells. It also affects cells that are lining your intestine, because your intestine, so much stuff goes through that you need to have new cells that are fresh and able to absorb nutrients and, give water to your body and do the things that they normally do. So there's a steady turnover of cells there. Your skin is in touch with things. So that's a normal area where cells turn over, they slough off, meaning they fall off at times. And when you wash yourself, you clean off that top layer. You don't want to be too rough, because then you clean off too many layers and then you might start yourself bleeding. And then you're like, okay, are my platelets intact? Can I stop myself from bleeding right now? So then you want to make sure that you not causing yourself to have problems. So if they give this medication to kill off the rapidly dividing leukemia cells, sometimes patients have intestinal problems. They may have diarrhea because we don't have enough cells that absorb the water back out of our intestine, our colon. Sometimes we can have, really, brittle skin and other problems because of it. So there are side effects that, we won't go into more detail, but yes, it can be bad to have too many white cells as well. All right.
That's crazy.
So,
I never would have thought of an animal having leukemia.
Yeah. So
yes.
pretty much most, if not all of the ailments that we have been recognized to have, they have animals that have those diseases. And in some cases, we have what's called animal models, and those animal models are animals that kind of mimic the disease in humans. And so we study the effects of certain things and medications, and that's how they learn to treat the animals and thus to help the humans as well. Okay, so thrombocytosis.
Let me interrupt the theme just before you go to this one. So
Okay.
I just want everybody to understand, everybody who's watching, that these pictures that Athema is showing us, these are blood smears. And so the blood has been drawn from the animal and smeared onto a glass slide. And Athema, could you explain a little bit? Yeah, like that. Could you just explain a little bit about how we do that and why we do that, so that we can see this and how the slide is stained and everything? We talk about when I did my presentations really early on in this series, we talked about how pathologists look at tissues and they have dyes on them. That's how we get to see them. So could you explain a little bit about that?
Okay, so this one is unstained, so we can see that the red blood cells that you see on this smear, they're red anyway. So without any stain, you can see that they kind of have this orange color to them. It's a little bit up here, which is where the blood smear starts, and then kind of, drag them out to smear them. And we look to see what we see on this picture. And then the one on this side is actually stained, so we can see that it appears a little darker, but it allows us to see mainly cells that have nuclei more readily, and it allows us to see our platelets because our granules within our platelet stain. So we look at the blood cells so that we can tell, do we have an anemia? Do we have, which is the low red count? Do we have, dehydration? If we have dehydration, then the blood will be sick. We'll have less space between the red cells to say that, okay, the blood cells are closer. So remember in the picture of the people walking in the street compared to the people at the concert, there are, gradations in between where we become dehydrated and we may not have as much fluid, which may concentrate the cells and make our cells a little bit closer together. And then, so we can see these conditions. We have machines that give us printouts of numbers, but we look at the blood smear to see the morphology of the cells, which is how they look, how are they shaped, what's the color, do they have parasites in them, like the heartworms that we showed you earlier. These are things that the machine is not going to tell us that we have a heartworm there. So we have to look at our blood smear and see that we have those heartworms. Okay. So thrombocytosis, we can see an increased platelet count with inflammation and iron deficiency. And if we see that, we call it a reactive thrombocytosis. We talked a little bit earlier about leukemia, but that would be in the immature cells that make the platelets. If they have the problem, then we would say a leukemia. But there are things that stimulate production of white blood cells that we talked about and stimulate production of platelets. And there are some that stimulate both. So if we have inflammation, we're going to produce platelets as well. So sometimes you can have 1 million platelets, which in most animals and humans, we have somewhere between 200,000 to 500,000 platelets, but we can, again, see this reactive thrombocytosis with inflammation. Okay, next question. Well, this is still part of the previous question. Cells can be given if not enough present. So we were talking about anemia. If we have anemia, just like in humans, we can give packed red cells. So this is an example of a bag of red blood cells that we can give to an animal that doesn't have enough red cells. And that animal hopefully won't mount an immune response against it. Remember, we talked about the immune response, those white blood cells that say, oh, I've seen this before, I'm going to attack it and get rid of it. So when we give a transfusion, which is giving these packed red cells, that is going to increase the PCB or hematocrit, which is a measure of how much red blood cells we have. And if we give the first transfusion, then usually there's no reaction because they haven't been exposed to it before. But we have to do what we call cross-matching to make sure that if we give blood, we're giving blood that is compatible. So blood that is like the blood the animal has, instead of being something that the animal is going to react to and cause destruction of those cells. Okay. And we can, if it's the white blood cells that we don't have enough of, we actually give medications to stimulate white cell production. We don't usually give packed white cells. We just give medication that stimulates our bone marrow to produce more white blood cells. And again, that can affect platelets as well. If we have not enough platelets, we can give platelet-rich plasma, but we can also give medications that stimulate platelet production as well. All right, next question. Whew. If an animal was cerebral spinal fluid and were to fall and hit its head, would that affect the severity of the fall injury or not? Absolutely. Wow. Absolutely. Absolutely. So like we talked about earlier, we need a little bit of fluid to kind of cushion things. And, you know, if you're walking and you don't have enough joint fluid, or if you have too much joint fluid, then that might be painful because you'd be causing more damage to the joint. So here we have a brain. This is a brain, a human brain. And this white case is our skull. And so as we can see, there's a space between the brain and the skull, but it's not a big space. The brain is covered by what we call meninges, which is kind of like a paper thin covering that overall protects it from what's surrounding it. But that fluid, that cerebral spinal fluid that's between the meninges and the skull is only supposed to be so much. There's not room for expansion in there. So if we have increased cerebral spinal fluid, that can be bad as well. You can have headaches and migraines. I have migraines and not good at all. Feels like an elephant sitting on your head and the elephant is not letting up. So in this particular case, if we don't have that fluid that's kind of protecting your brain, then not only would it make it very painful for you to walk around because your brain would kind of be knocking on the sides of your skull as you're walking. So you can knock yourself out just by walking. But if you hit your head, then instead of your brain kind of moving a little bit, so another comparison, think about a baby in the mother's womb. So when the baby is growing, the baby's in what's called amniotic fluid. And while the baby is developing, that amniotic fluid is surrounding that baby. So if the mom is walking, the baby is kind of like just kind of gently moving with the mom, but the baby's not like bouncing all around in the womb because that fluid kind of tempers the movement. So a lot of times people say when the mother is most active, the baby is sleeping because that very gentle movement while the mom is moving is kind of, you know, rocking the baby to sleep. But then when the mom sits or lays down, when the mom is trying to go to sleep, then that's when the baby's active and like, oh, what's going on? Let's do some stuff. So similarly, if you don't have that fluid in your brain, not in your brain, but in your skull to cushion your brain, then yes, absolutely, it would be so much worse if you were to fall or hit your head. So we think about people in car accidents. Since we don't have much space between the brain and the skull, we can actually get what's called a concussion. So we have here a concussion, which is when the brain kind of hits the side of the skull too hard. So if you hit your head against something, your brain can hit the side of your skull. And if it hits hard enough, it might bounce and hit multiple times and cause you to get what's called a concussion. You'll be foggy in the head. You may have headaches. You may have unsurety of what's going on. You may be confused. You may have loss of words. Like sometimes I get loss of words. I'm like, did I get a concussion? So,
that's what's happening a lot. Excuse me, but that's what's happening a lot that they're talking about right now in the news with football players and them aging.
Yes.
It's impacting them as far as is it like early stage dementia or Alzheimer's from those constant concussions?
Yes, yes. Getting hit. You know, my daughter was she played two games last night, but she plays flag football amongst other sports. And, you know, it's flag football. So they're supposed to be pulling the flag. But some of them folks was like falling on people. Oops, like you ain't falling on somebody by mistake. Did that on purpose. So, you know, sometimes people don't play fair, and, you know, the referees weren't playing fair. They weren't calling any of the oops moments that were obviously not oops moments and stuff. But anyway, getting back to the brain. So yes, your brain needs that cushion, but, you know, you can sustain injury if you don't have that cerebral spinal fluid more severely. You might also create enough damage that it could kill you. Even with the cerebral spinal fluid, if you get hit hard enough in like your temple, it can actually, you know, kill you. The nervous signals that I also talked about, they travel, and that cerebral spinal fluid conducts those nervous impulses, you know, to your peripheral nerves. So it's not just necessary to just kind of make sure your brain is moving a little bit more gently, but it's also needed for you to get the nerve signals throughout your body. Okay. I wonder if she taught other kids about circumstances of becoming a veterinarian. So, circumstances of becoming a veterinarian. So the word circumstances sounds to me as a bad thing, but I hope to not be only thinking of the bad things. So becoming a veterinarian, we'll talk about a little bit of how to get there, but I hope I'm not misunderstanding the question. So what I have here is how to get to vet school, in addition to the fact that, yes, I have taught about, you know, being veterinarian and, you know, answer questions about how I do my job, what kind of aspects of my job I like, and what kind of aspects that I don't like. So as I have here, elementary school, middle school, high school, college students, and, you know, visitors to the vet school that are interested in becoming veterinarians, I do talk to them about, you know, different questions they may have. There are good and bad things to any job, and not just being a veterinarian. So one of the things that I love is being able to help a lot of animals and a lot of people. And, you know, some people are like, did you become a vet because you don't like working with people? Keep in mind that because we're veterinarians, we can't talk to animals, so to speak. So we have to talk to the people. So you don't become a veterinarian if you don't want to talk to people. You have to talk to the people to say, okay, why is she here? So sometimes you'll have the animals that come in with obvious gaping wound on the leg, and it's like, okay, that's why you're here. But if it's not an obvious thing that you can see with your eyes, you got to talk to the client to say, hey, why is Fifi here? Why is Spot here? What brings you in today? So with some patients, it may not be the owner bringing the animal in. So we may not get that bit of history. I once had two roommates bring a dog in. The actual owner of the pet was on a plane flying to California, so they weren't available for comment. And the two roommates brought the dog in, and they didn't know why they were bringing the dog in, but the owner told them just to bring the dog into vet. But without telling me why the dog needed to be at the vet, I did my physical exam. I listened, I felt around, palpated, making sure that the animal didn't have any obvious problems that I could detect. So I didn't detect anything that I could clearly give a medication for, didn't know whether it was there for vaccinations, didn't know it was, you know, what it was there for. So the roommates couldn't say, spend $50,000 or $5 on diagnostics or medication that we didn't know what to give, because the animal seemed completely clinically normal to me. So I had to say, completely clinically normal, stable, bring him back Monday, or when the client that, you know, is able to tell you why the pet needs to come to the vet. So that happens sometimes. So that can be a not so good thing. Sometimes we can, help the animals and cure them of things like certain metabolic problems and, lamenesses and stuff like that. But sometimes they have diseases that we can't cure, that we can't stop them from being in pain. And we have what's called quality of life. So we have to consider, is this animal suffering? So if this animal is suffering and we can't put an end to the suffering by giving it medications or changing things about the environment, then sometimes we have to do what's called put them to sleep, euthanasia. And that euthanasia is to stop the animal from being in pain. But that is a sad part of my job. So I don't like to do that, but sometimes it is something that I'm called to do. And that some problems don't have medications. So just like people can get tumors, we talked about leukemia. So that's when increased numbers of blood cells are in the blood, but we can have cancer anywhere in the body. So leukemia is a type of cancer, but we can also have cancers in body organs, and we can have cancers spread to other areas of the body. And once they spread, sometimes it's harder to give treatments that will help get rid of the cancer. Okay, so this is an example of a career day at George Washington Carver Elementary Academy. This is Dr. Casey Graves. She is a 2016 graduate of the College of Veterinary Medicine. I'm a 2001 graduate of the College of Veterinary Medicine. These are some examples on my computer here showing veterinarians in different aspects of industry and private practice and, inspection. When you go to the store, you don't want your food to be green, right? So if you see a piece of chicken and it's green or it's purple or it's blue, you're not going to eat that. Hopefully you're not going to eat that. So if we do see that kind of stuff before it gets to the store, as a veterinarian, as a food inspector, we would do what's called condemn that piece of meat. So we would take that off of the, belt that's going around that says these are the meat products we want to send to the stores, so that you don't get the purple and the green meat at the stores. But if you've eaten green and purple meat, I want to hear about it. Okay, I want to hear about it. Tell me about it. So being a veterinarian is awesome. I also have some worksheets here that I kind of gave the students to work on, because I love my job. I love every aspect of my job. And so Dr. Graves and I took turns talking about what we do and answering questions about being a veterinarian. And she's actually in private practice in Las Vegas doing excellently. Love her to death. Okay. How do you think I can become a veterinarian? So to become a veterinarian, you have to stay focused, keep your eyes open, be diligent, meaning be hardworking, and just keep your eyes open and your arms open to receive different experiences with animals. And, having great grades definitely plays a role, but you also should be well-rounded. So if somebody is just in the books, I've been on the interview committee and I've interviewed animal lovers, but I interviewed some, very rarely, but I interviewed this one young lady that never had a pet, never worked in a vet clinic, but she's applying to vet school. So I'm curious to know how she knows she wants to be a veterinarian if she's never worked in a vet clinic, never worked with animals, never had a pet. So experience those things and determine if that's what you want to do. Don't just say, I want to do something if you've never experienced it, because some people do come here and they figure it out when they get to vet school, after they've paid all the money to take all the prerequisite classes, which are the classes that you're required to take before you get here. So you can learn about things like anatomy and blood cells and other things, physiology, how things work normally. We learn those things baseline. We have to have a baseline before we come into vet school. So if we learn those prerequisites, then we have to pay for applications to vet schools. We have to pay for getting transcripts, which are, if you went to undergrad and you took classes at other universities, and you have to get all those transcripts, which are all the printouts that show your grades. And then you get here and then you pay $40,000 to go to vet school. And then you get here and you're like, I'm here, but I don't know what's going on. I'm not enjoying this. You don't want that to be the case. So experience all you can before you get to the point of applying to vet school to make sure that it is what you want to do. Being a veterinarian, you don't just have to do private practice. You can be a zoo vet, you can be a researcher, you can teach. And I do all of that stuff right now. Private practice, I do that right now. You can do food inspection, you can do government, you can, be a lab animal vet. You can do, the sky's the limit at what you can do. So in a lot of ways, we help people as well. We don't just work on animals. We do not work on people. We help people by working on animals and knowing about animals. So there's veterinarians behind the production of these vaccines because they had to do trials in animals in order to get to the point of, using the vaccine in people. Okay, I want to know how to make animal medications or medicine for my dog and cat. All right, so this is beyond the scope of this presentation. You go to vet school or pharmacy school to learn about these things. And so I am not going to tell you how to make medicines for your patients, for your pets. If your pet is ailing, you want to bring them to the vet so that the vet can diagnose the problem and give the right medication, okay? But if you give your pets a balanced diet and make sure that, you give them the preventative medicine so they don't get the fleas and the ticks and the heartworms and stuff, and just do all you can to keep them healthy and safe, walk them on a leash, make sure that they don't get run over by a car, then you'll keep them out of the hospital having the need for medication. So these are some of the things that we need to keep in mind, okay? How hard is it to be a veterinarian, and how long do I have to attend school in order to be a veterinarian? Okay, so that is kind of relative to how long it takes you to do each step. So completing elementary school, completing middle school, completing high school, or earning a GED. I actually was home taught, so I didn't go to high school. So I actually earned my GED when I was 16, and I went to college when I was 17. So getting a GED is like getting a high school diploma, only you go straight to the test. Prerequisites that we talked about, you have to take certain classes before you get to apply to vet school because they have to know, did you pass your anatomy? Did you pass your physiology? Did you pass your microbiology? Did you pass your history, your sociology? Did you take a language? Did you take physical education? These are some things that they require you to have experience before you get to the point of applying to vet school. Some people get an undergrad degree while earning their prerequisites, but some people don't. So you don't have to have an undergraduate degree to come to vet school, but you do have to complete those courses, and they can vary depending on what vet school that you want to apply to. So at Tuskegee University, we have what's called a 3-in-1 program. So we have a program where students can come into vet school early and then complete that last year of undergrad courses as a part of their veterinary curriculum, and then get their DVM and their bachelor's degree together. Okay, make sure it's what you want to do. Speak to somebody in the area of veterinary medicine, such as now you're listening to me as a veterinarian talking to you. You can also visit local, places that, have animals, like your shelters, your veterinary clinics, zoos, and talk to the people who care for these animals so that you can get an idea of what they do. Shadowing is something that, is good, but it's also better if you get the hands-on experience. So when I was growing up, I lived, I would say 5 miles maybe from the SPCA, probably less than that, maybe 2 miles. Across the bridge and down the street, I went almost on a daily basis to go to the SPCA. I was too young to work there, but I was so persistent. At 16, they gave me my own set of keys. They gave me my own set of keys so that I could, take animals out of the kennels and show people, let them touch them, let them hold them, let them spend time with them so that they could adopt them. So I had my own set of keys, but I wasn't working at the SPCA. But I had lots and lots of experience because I was there every day, and they were like, hey, all right, here you go. So then eventually, once I became 18 and I was in college, I actually got a job there working in education and stuff. And I enjoyed all of my experiences there. So stay focused, make sure that you get that experience and start small, get a pet. And, you don't have to start with getting a lion, which I don't recommend at all. You can start by getting something really small. Like I had cats. And cats, they use litter boxes very well. They went inside and outside, but nowadays I'm like, keep them inside because we can't stop them from getting things like feline immunodeficiency virus, which is FIV. And FIV is like human immunodeficiency virus, but in cats. So HIV, we know, is something really, really, difficult for some people to deal with. And that can, predispose them to AIDS, which is another immune disease. So since we can't stop them from getting FIV, and we can't stop them from getting leukemia, if feline leukemia, which is a type of virus that can give them actually leukemia, like we talked about, then keep them indoors so that they don't get exposed to it, because it's a sociable thing that they can get from other cats. So we can vaccinate against the feline leukemia virus, but not against the FIV. But just keep them indoors, keep them safe so they don't get into those fights. Another thing that I wanted to talk about is because if you let your cats outside and they're declawed, they can't defend themselves because, they scratch and stuff. That's what they do. If they don't have claws, they can't defend themselves properly. So that was a side note. All right, so stay focused, study hard, and get experience. Or even start with a pet.
Before you go further, I heard you say something that I hadn't heard a vet say yet about language. Is that a required thing usually, learning another language, or it's just another thing that you suggest?
So just taking a language class, it's not a requirement at all for you to learn the language. You don't have to prove you know Spanish or prove you know French or Latin or whatever. I took Latin and I took Spanish both in undergrad. I was self-taught with Spanish a little bit before I went to undergrad, and then I took a year of Spanish and I took a year of Latin. And I took the year of Latin thinking that it would help me with the medical terminology because Latin is the base of medical terminology, but it was conversational Latin. So ita vera, I learned how to speak it, not, it wasn't telling me about the basis of the Latin medical terminology. So, but medical terminology is a required class. Medical terminology is required so that you can learn the lingo, learn what you're learning about. So if you know ahead of time what microfilaria are, if you learn ahead of time what it means to say inflammation, itis, if something has the itis on the end, that means inflammation. So medical terminology is required before you apply to vet school so that they can make sure you have this basic information, because sometimes when we're teaching, we're talking with these terminologies. And so just like with anything you haven't experienced before, it's like a foreign language. So if you don't study it, then you won't know. So like if you have a foreign language and you go over to Germany, you haven't never spoken the language before, you can't know how to ask for the restroom or where's the restaurant or how to get to the cab, so you would at least learn like the basic language, or you would have a guide that could speak for you to let you know what's going on. So going to vet school, realize, is like learning a language. You have to do your studying before you get there. You have to learn a little bit before you get there. All right. So these are some of the areas of veterinary medicine that you can go into. Sports medicine. So, we have racing greyhounds, we have racing horses. These animals need veterinarians that know how to deal with lamenesses specifically. So these are specialized people. You can be a specialist in any area. I'm a specialist in clinical pathology. So we talked about the blood, diagnosing tumors and stuff like that. Aerospace medicine. There are animals that go into space. We do have these things now. They had a chimp or something in space, and this was decades ago that they showed the chimp in space. Animal assisted activity and therapy. So we have animals that are nice enough that they love everybody that they see. So these animals are, therapy pets. They can actually go to nursing homes and schools and things of that sort and be loved on by all that want to love on them. And they won't do anything harmful. Mm-hmm. These animals have to go through rigorous testing to make sure that they won't do something that's not, not good. So, if you bring an animal to a nursing home or to a school, you don't want that animal to bite anybody. You don't want that animal to scratch anybody or, bark really loud or growl or do things that, may make people, shy away. You want to make sure that they're able to understand that there's different noises in the environment and, just different things that they have to be aware of and not react to adversely. So, we talked a little bit about government and academia. I'm in academia and I've been in industry. And like I said, I'm in research and private practice. So you can work in various areas. And then I actually don't have on here, food inspection. So FDA, food inspection, making sure that you don't get green meat at your school, at your house. All right. So professional activity, of course, a lot of people go into private practice, but then there are some other breakdowns. And I know this presentation might have to be broken up into two parts because we're taking a little bit longer than we initially planned. But,
That'll work. That'll be fine.
Okay. So, again, a lot of people go into private practice, but there's a breakdown of some of these other type areas as well.
And you talked about food inspection, but that's federal. FDA is.
Yeah. Okay, cool. So maybe I did represent it a little bit, just a little bit.
We did have someone that really went into a lot of detail about food inspection. That was very interesting. Yeah.
Wonderful. I don't have any meat in here to show you. I'm sure they showed you some stuff. All right. So are animal medicines safe and effective? So we say animal medicines. There are some medicines that people take that animals can take too. But again, I'm not going to be the one to tell you what animal medicines and human medicines are the same because you need to bring your pet to a veterinarian that practices to diagnose a problem and give you a medication for that problem. So I'm not going to tell you that, you can give your pet this, that, or the other. Okay. So you have to base the medicine on the size of the animal, the type of animal, the breed of the animal, sometimes even whether it's male or female, that you want to make sure you give the right medication. Depends on the problem you're treating as well. Are you treating something that's on the skin topically, or are you treating something that's internally, like in one of the body organs? These are things that you have to consider when giving medication. So, if you have like a little bobo on the skin, then you can put medication directly on that bobo. But also keep in mind that a lot of animals, especially dogs and cats, they have hair. And like with our German Shepherds, their hair is really thick. So if I'm trying to treat a skin problem, I might have to give systemic medication, so something by mouth. But other times, like if it's just one little small spot, then I can shave the hair off of that spot and treat that spot directly. So we have to think about those kind of things. But yes, there are a lot of medications that are safe for animals that, we give on a regular basis. Okay. And then we talked about the preventative medicines that stop them from getting things like heartworms, fleas, and ticks and so forth. So those heartworms that we talked about earlier, they are transmitted, which means dogs get them, and some cats can get heartworms too, and bears. So lions, tigers, and bears, oh my, they can get heartworms. They get them from mosquitoes. Everybody hear me? Do you hear me?
Yes.
Mosquitoes. So when I talk to clients and they're like, oh, he's inside only. My dog is inside only. Mosquitoes get in the house. Mosquitoes get in the house.
Yeah.
Same thing with flea and tick medicine. They can jump on us and get in the house. And if you have a problem with them, they can be a nuisance. Oh my God.
Yeah.
Oh my God. it can be a really, really big problem. Sorry. Uh-oh. It can be a really, really big problem. So you have to make sure that you have your pets on prevention, because mosquitoes can get in the house. And all it takes is that one mosquito that has that heartworm infective stage to bite and deposit that mosquito, to deposit that microfilaria, immature forms, into the blood of your dog. And then it takes 6 or 7 months, and then you get those really long worms that can actually be so many. They live in the pulmonary, which is lung vessel, but they can have so many that they can actually block chambers of the heart. Okay. I wish I put a picture there, but I don't have it. Mm-hmm. So yeah, they can block the heart and cause really, really bad, problems. So we want to make sure to keep them on prevention so that we can keep them healthy. Okay. All right. So what is your favorite animal and why? So I love the kitties. So this is a kitten. This is Rocky. So Rocky was a stray that was brought in and became the love of the entire staff. And Rocky was a kitten, and he had a big belly. But sometimes when kittens are strays and they, don't have the nutrients that they should have, their abdominal muscles as well as their other muscles don't develop as well. So they can have a little bit of a pot belly, but shouldn't be so big that it's bigger than his head. His belly was bigger than his head. I'm sorry, I don't have the picture to show you. His belly was bigger than his head. Mm-hmm. But this is when he was feeling better. But Rocky was in the clinic before I went to take boards 1 year. When I came back from boards, Rocky wasn't eating. I'd like to say I attributed it to me being gone and him missing me so much. But I was like, let me look at his poop. Yes, we look at the poop and see what's in the poop. So we call that exam a fecal. So a fecal is when we look at the poop and see if there are parasite eggs or parasite larvae or parasite or other forms of parasites in the feces that tell us that those parasites are in the animal and we need to treat the animal for those parasites. So I looked at Rocky's poop on what's called a direct smear under the microscope. So you guys see my microscope right here? See my eye here? So this is my microscope. And me and my microscope, we look at all kinds of slides. And, I took Rocky's poop and I looked at Rocky's poop. And he had what was called coccidia. And the coccidia had, they were present in large numbers. And coccidia can make their intestines bleed and they can be really, really sick from having them. So I treated Rocky for the coccidia and he got better. He got better and he got adopted. He was so lovable and they really enjoyed him. So this little adorable kitten got a home, and I'm glad I was able to find out what was wrong with him and treat him. Okay. Mm-hmm. I love them because they have very sleek personalities. They are pretty self-sufficient. Like I said, you show them to the litter box and they know how to use the litter box. You give them food and water and they're straight. I know some people who have cats, they can leave for weeks at a time as long as they leave enough food out and water. And, they have these self-feeders and these self-watering, containers and stuff like that. And since they have the litter pan, there are some that have revolving cleaners as well so that they can not have the poop building up, because coccidia, that's something that needs to have 24 to 48 hours to become infective. So just be careful of that. But they're overall lovely balls of fur that I just love so much. I'm allergic to them now, so that's why we don't have indoor cats, but we had a couple of outdoor cats that somebody else took in. And we knew somebody else took them in because one of them actually came back with a collar like months later. So I guess they got out and they came back to say hi to us, and we were like, oh my gosh, Twilight. And then she disappeared again. So I guess she went back indoors. So I know she's doing well. All right. So how many times have you created animal medicines? I can't count. It's too numerous. But sometimes we mix medicines with things that we can take as well. When I was younger, we used to use K-roll syrup on pancakes, and you can use cherry syrup in some drinks, but we can also make medicines with that as well, because we have things that the animals need to take, but sometimes the medicine itself doesn't taste too good. So it's not going to help you if the animal doesn't take the medicine. And so we have to have what's called not only patient compliance, but client compliance. So patient compliance means that patient has to be amenable to get that medication. And client compliance meaning that client has to be able to give the medication. So if it's a medication that the animal doesn't like, then you're going to have trouble getting that medication in the animal. So you want to get it to the client in a form that they can give it to the animal and safely administer it without getting bit, chewed, scratched, or otherwise harmed. All right. How does it work to work with different types of animals? All right. It's awesome being able to work with different types of animals. Like I said, I work with all kinds of zoo animals, and these are some of the animals that I've worked with in private practice. I'm going to try to move this a little bit. All right. So we have, a pack of kittens. Oh my gosh, I got the same shirt on today that I have in this.
I noticed that.
That's really interesting. And then we have, this pack of puppies. This is actually a Tupperware. This is like a Rubbermaid container. Sometimes people bring pets in interesting containers. Sometimes they just bring them in arms. Nowadays people sometimes just walk in with cats in their arms. And I'm like, back then we never would just walk with a cat in our arms. We would always have them in a carrier because they can get out anywhere. And we have this little bunny rabbit here. This was a bunny that was boarding with us, and she was a sweetie pie. So you see, she's just being held by one of the ladies that worked at the clinic. This is Cinnamon. She's a guinea pig, and she was sweet as well. She came to us just for a physical exam. This down in the bottom is what's called an agouti. And I'm sorry I didn't include the picture that you could see the whole body, but it looked like a rat, but it was called an agouti, Agouti. And this little lovely creature is our hamster, our beloved hamster Nugget, and he's eating a piece of broccoli. So they love fresh vegetables and fruit. All right. These are my ferrets. These are my personal ferrets. This is all three of them down in the bottom left. Pepper is in the middle. Brownie is over here to the left. And Ivory is the one over top of all. Ferrets are sociable creatures, and they love to just kind of pile up on top of each other. And they are really busy creatures. And a group of ferrets is perfectly called a business. So we have a business. A group of ferrets is called a business. Pepper in the left up here has, she's just yawning. If you scruff them, which is what my daughter's doing here, they'll yawn. It's very funny every time. You scruff them and then they just, yeah. This is Brownie, two pictures in the middle of showing him just kind of vegging out. He eats and then, he's just tired. So they are very flexible. As you can see here, his nose is almost to his butt. His butt is right here. So, they're very flexible. They almost feel like they don't have any bones because they sleep in so many different kind of funny ways. But, it's so cool. And this is Ivory over here. As you can see, if you pet them the right way, they just fall asleep. So just like cats, they can sleep 20, 21 hours out of the 24-hour day. But I don't think these ferrets sleep that long. They are most active at dusk and dawn. And so you can hear them doing things when nobody's holding them. And, we love them bunches. All right. We also see not so furry creatures. This is a monitor lizard. She came in because she, I don't know if you see this structure here. This is part of her egg sac. So she was holding eggs in there, but she could actually go ahead and pass the eggs herself. So medications were just given to her to kind of support her through the process. And this is an X-ray of her, just showing her internal body organs. I'm not a monitor lizard expert, so I'm not going to point out what you're looking at because I don't know what I'm looking at. Another veterinarian in the
before you go further, I just thought about it. Since our youth that are in the Bronx are going to be seeing this, and we talked about ferrets being illegal in only 2 states, which are California and Hawaii in the United States, but where they are in the Bronx, even though it's legal in New York, it's the Bronx and Brooklyn, and I think it was one of the island, what is it? Well,
It was all
they're
the 5
illegal.
boroughs.
Was it Queens?
Yeah, the 5 boroughs. And so I just wanted to touch on that because that may be something that Danielle Corbin and her students may want to look up and know more about, because seeing this, they may want them, but right now they're illegal where they live. So I just wanted to touch on that a little bit. And
Also,
that'll be something neat for them to look up.
Also, something to know about ferrets. So ferrets, they have scent glands, so they can be stinky, but these have those scent glands removed. They are what's called induced ovulators. So just like cats, they can keep cycling into being reproductively active and ready to make babies. So they can have these chronic productions of hormones, which can actually make them sick. But they have been spayed, the females have been spayed, and the males have been neutered. So they have the scent glands removed and they've been neutered and spayed. So we're not worrying about those things with these babies. But those are things that also need to be kept in mind. So you have to be aware of the health and preventative care of whatever type of pets that you decide to take. They also have, you see these teeth in the left-hand side, these really long teeth, and they continually grow. So they have to chew on things. So you have to supply them with things to chew on. They like to chew on the kennel instead of the chew toys that we get them. So same thing with the hamster. The hamster love to chew on the cage instead of the chew toys that we got him. So anywho, something you have to take into consideration. But again, this is a monitor lizard. This was seen by one of the other veterinarians. I do see exotics, but he saw this one. This is lungs up here, and these are probably GI structures and egg structures. And then we see our bones. I can point out the skeleton. So this line down the middle is the spinal column, and it's part of the vertebral column, is part of the skeleton. And within this narrow, you can see this kind of more lucid or kind of a little bit darker area. This is where the spinal cord runs. So we can see this thinner area because at the top of the vertebra, which are the bones in the backbone, there's a thinner covering, and there are larger prominences on the sides of the vertebral column. So since it's kind of thinner and flatter covering on top, we can kind of see that here and know that our spinal cord lies within, but it's a very protective area so that we don't have to worry about our spinal cord getting hit with, you sitting down. You don't have to worry about that kind of trauma. Okay. All right. So how do you get chocolate out of dogs and how long does it take? So we have to give them stuff to make them throw it up, and to stop it from being absorbed. Some other things can also, I guess, come out of the system that way as well. And then we give what's called activated charcoal so that it can bind to the rest of the stuff that didn't come out to stop it from being absorbed as it's transiting the system. So
maybe we need to say that chocolate is poisonous for dogs.
Yes, so chocolate is poisonous for dogs. So thank you to the young person who had this question. So chocolate has what's called theobromine in it. And that's a stimulant, just like caffeine in coffee and certain teas. Stimulants are really bad. So they can, cause excitability in animals, but chocolate can also irritate the intestine and cause diarrhea and vomiting and just overall really bad feelings. There is a general presentation that we all learn affectionately as ADR. So presentation ADR means ain't doing right. So that patient that ain't doing right, that can be a myriad of things. That could be, oh, my foot hurts, or that could be, I got something wrong with my belly or something wrong with my brain. So you got to make sure that ain't doing right is explained. So you got to ask the right history questions. And we ask what's called open-ended questions so that the people can give us more information. So if I just ask you, did your dog eat today? You'll just say yes. That's a closed-ended question. So that's not giving you the opportunity to share with me more information. But if I ask you, tell me about Fifi's diet, tell me about her eating habits, then that opens the floor for you to give me how much she eats, what she eats, when she eats, did she eat, how much she ate, when did she not eat, kind of thing. It gives you the opportunity to just share with me everything you know about that particular history. Okay. All right. So this is the outcome. And just warning, this graphic video for those of you with sensitive stomachs.
Oh my goodness.
So it's brown because there's chocolate in there?
So I know you hear that in the background. You think it might be a dog, but it's actually a parrot laughing.
Ah,
I'm gonna let you hear that a little bit more.
did all of that come from that dog?
All of that came out of this dog. But you hear that in the background, right?
This is really,
Yeah.
yes, yes. And this is really
Yeah.
important for young people to know, because with us just getting past Halloween, it's important for them to know to keep that candy from their dogs.
Yes, yes, keep the candy from the dog. So, you know, this was a client that came in, and actually a month prior to this incident, this happened again. So this dog had eaten chocolate that was from somewhere, I guess went in the owner's purse or whatever. And this time the client had gotten a gift from someone, and it was under the Christmas tree. And the dog decided to get out of the kennel, and there you go. So
And
they
ate the paper wrapping and everything.
ate the wrappings and everything. And they came home. They were supposedly only gone for like 30 minutes. They came home to find that the dog had eaten all of these chocolates, and they brought it in 30 days after they had gotten this whole thing done. So they were like, we just, you know, can you do the same thing you did before?
Oh, God.
Basically, that's what happened. But the parrot in the background was a Quaker, and the Quaker parrot was laughing at what was going on. So, you know,
gosh.
they're very appropriate in what they do.
It's the deal.
Oh, sorry. Uh-oh. All right. So can animals and people take medicine for, can animals and people take the medicine for animals or for people? So yes, like I said, there are some medications that both animals and people can take, but that's beyond the scope of this talk. Got to go to vet school, got to go to pharmacy school to find out what those medicines are. And, or if your actual pet goes to a veterinarian and gets a problem diagnosed that requires a medication, then you can find out, oh yes, we take that. So you can find out at that.
And see, my mom wasn't going to take our animals to the vet, so she would just give them Pepto-Bismol. She'd give them aspirin. She was like, either they take what's in our house or they don't take nothing. So really,
cats.
We were probably hurting our animals worse.
But, you know, you say that, and, you know, it's ironic that back then animals, it wasn't, you know, unheard of for animals to live like 12 to 15 years. And like, I saw a couple animals that were even older than 15 years. And I'm just like, what, a large breed dog? 17, what? 17?
Wow.
So sometimes there are pets that have, you know, great genetics and great systems, and they live forever, regardless of what they've given. I had somebody say, yeah, I've been giving my dog grapes for some time. Grapes shut the kidneys down. So don't give your dog grapes. Don't give them grapes.
Mm.
And raisins or dried grapes, don't give them raisins.
No.
The grapes and
And
raisins
I've
can
been
shut the
giving my
kidneys
dog
down.
grapes. Joy loves grapes. I've got to
Oh,
stop
oh,
that.
no,
Oh my
no,
goodness.
no, no.
Oh my
Okay.
goodness.
Grapes will shut the kidneys down before you can say hello. They will.
Now, let me ask this, unless we're going to do this in two parts. How much longer for your presentation, since they're going to be so interested. I mean, this has been such a great presentation. Oh my gosh. How much longer do we have?
I thought I would be able to see the number of slides here. I don't recall.
Let me
Freeze
see.
your
Yeah. We're ending. We have one more slide. All right. So yes, there's some medications. Yeah, Pepto-Bismol is one, but like I said, you want to have the problem diagnosed by a vet if possible, and then the proper treatment given, making sure the amount is given. With the Pepto-Bismol, they cannot digest those tablets, and they have radiographically dense stuff in those tablets or capsules. So you can see them on an x-ray just traveling through the GI. So they're not going to do anything. So you have to give the liquid if you do give it, but that's interesting because you can see it on the x-ray.
Wow.
All right. So what was the easiest pet you've ever taken care of? It was a middle-aged dog that needed a nail trim. So as we see here, if we don't trim the nails can overgrow, and these are kind of bending back into the paw pad. And I've actually seen some where the nail has grown into the paw pad. And so we call that embedding. And so we have to cut the nail. The pink part is where you bleed. So make sure that we don't cut back there, but we have to cut the nail so that the nails don't, grow into the paw pad, because that can actually make them lame. And so this dog came in, it was, like I said, a middle-aged dog. So could have possibly started having arthritis, but I said, well, let's see what we do with this nail trim. And if this solved the problem, then hey, wonderful. So we trimmed the nails and the dog stopped being lame. Piece of cake. So observation is a big part of being a veterinarian. And once you can pick up the obvious, go ahead and treat those things. But sometimes, like I said, we do have to talk to people in order to treat the people. So this is before, and I'll move this. Okay. Wow. And this is after. So we can see how having these, nails so long can cause them to have trouble walking around. Yeah. And so when we trim them, we can see just how nice. And these have been dremeled as well, so we can kind of smooth or sand the edge so they won't be so sharp. Okay. All right. So take home message, give it a try before you decide it's not for you. This is a tiger that was seen at Tuskegee University College of Veterinary Medicine. This is Sam. He's now a doctor of veterinary medicine. This is Dr. Bovelin. She graduated class of 2000 from Tuskegee University, so a year before I did. And this was a patient she saw that had an eye problem. All right, so this is, excuse me. Sorry, this is my information.
Now, thank you so much.
She's coughing. She's gonna get something to
okay.
So while Athema is getting herself some water, I just want to say thank you so much. You can see in the background, you can see that there's a two-headed microscope there. The clinical pathologist uses a microscope first and foremost for like 99% of the work that we do, just like an anatomic pathologist, which is what I am. And we have the two heads because that way two people can look at the same time and discuss what's being seen on the stage. And it's a way to teach, and it's also a way to consult. I miss I miss using the two-headed microscope. So Athema, thank you so much. So much. Um,
No worries. I
just
really
wanna-
enjoyed myself. And like I said, at some point, I hope to be more interactive at some point, but thank you for this
You
opportunity.
were
I
amazing.
really enjoyed it.
Yes, yes, you were amazing.
Jumped up at the end. I don't know what happened.
Yeah, because it was pre-recorded, the fear is that the person presenting also would not be entertaining and hold the attention. But you were absolutely phenomenal. And I can't
Thank
wait.
you.
And that's why, we ran way over, but it's because you were so interesting. And even, see, one of the reasons that I did not, I laughed with Monique and told her how sensitive my stomach is, but the way you presented the information, even before, I wouldn't have looked at showing what came out of that dog. But because of the way you explained it, and even talking about the blood cells and understanding it before, I didn't even want to see my blood going into a vial when they were taking blood. But now the way you explained it, and then I'm understanding why they're taking it and how they're going to look at it. I was brought into it, and I didn't even think about all the things that normally would have made my stomach queasy. So I loved how you present it. I think that not only is it going to be interesting for our sixth graders and for our youth that aren't even in the sixth grade and those that are older, but I think even for adults, this was just an absolutely phenomenal presentation. And I just thank you so, so much and appreciate all the work that you've put into it.
Thank you. And like I said, I truly, really, really appreciate and adore the questions. So thank you for all of those that submitted the questions. I really,
Yes.
really appreciate you. Because without you,
Yeah.
I would not have made this presentation for real. So
Yes.
thank you all both for the
Monique?
opportunity.
It was absolutely phenomenal. Absolutely
Yeah.
phenomenal.
So feel free to
And,
send me any questions if you guys have any questions. Go ahead.
If we have any
Yes,
further,
yes.
I wanted to say that for me, so I'm an anatomic pathologist, and for a long time, I really didn't want to have anything to do with clinical pathology. But after a certain point in time, I developed an interest in it. And I'll tell you the reason. It's not because I don't like looking at the slides. We put the blood on the glass slide and we put the fluid and we stain it and everything. That part is fine. It's all the machinery that is required. When you mentioned earlier that we have to look at things, but there's a machine or several machines that also give us a lot of numbers about what's happening in our blood and hormone levels and all of that kind of stuff. I was afraid of the machines, but I love looking at the visuals. I'm a visual person, and that's why for me, I want to emphasize for people who are visually that are visually what's the word I'm looking for? They are
visually inclined.
Visually inclined, yes. That this can be something that is just very, very inspiring for you. And you'll develop a passion for it because you can see so much and you can help the animal and by extension often help a person by looking at and interpreting what you see. It is magic. There's magic. It is magic. For those of you who like numbers, go into clinical pathology. Because you'll get numbers upon numbers upon numbers, numbers everywhere.
Yeah. The other thing too, with Tuskegee coming up so often, see, only during Black History Month do kids keep hearing about Tuskegee and maybe George Washington Carver. Excuse me. I like the fact that they have now met you and seeing a young woman that has gone through Tuskegee and can relate to that besides just reading about George Washington Carver, and putting that in their mindset that is somewhere that they also can go.
Yeah.
Because so often, again, young people only have heard about something, read about something, and that's so long ago. It's still vital information, but now they've met you and they hear what you. Yes.
Sorry. Go ahead.
Go ahead. No. That's it.
Okay. And not only, knowing that George Washington Carver, he's like the father of Tuskegee, but that there are George Washington Carver schools in a lot of different cities. So we have a George Washington Carver Elementary Academy here in Tuskegee. There's a George Washington Carver school in Montgomery. There's a George Washington Carver school in Opelika. So you know, a lot of people recognize that he played a pivotal role in agriculture and actually the development and flourishing of Tuskegee University in that aspect.
Mm, outstanding. Outstanding. Monique, any other questions or anything else?
I don't have any other questions. We have Athema's contact information right here. We will most certainly let you know if we get any other questions from our audience. And I guess I think we might have to divide this into 3 parts. This is just so rich. I can't thank you enough, Athema. I can't thank you enough.
You're welcome.
This is why it's so important that we're going to promote it for not having our session, the upcoming session, but to promote this, because we need to make sure that our entire community not only hears this, but shares it with their community, because this was just phenomenal. So I want to thank you again, Athema, because I mean, I learned so much. I learned from every one of our special guests and veterinarians, but this one just was for over the top for me. So thank you
so much. Thank you so much. Oh, I do have one more thing. So the presentation I knew was going to go greatly over, but I appreciate the questions and the commentary that, you know, that we had back and forth during the presentation, because it actually did give more information and allow a lot more explanation where I wouldn't have even thought to have that extra explanation. So I do appreciate that, you know, interaction in between, because it helped me explain things that I didn't know people really cared about.
Oh yeah.
And you know what? And didn't the youth ask some amazing questions?
Yes. Oh my gosh. So amazing.
Yeah.
So amazing.
Yeah. Yes. So, yeah. They led the show with those great questions, and it pulled out all that knowledge and experiences that you had. So some of those questions, I was like, wow, that's from a kid.
and I want to thank Monique, because the question that said complex question, I had seen the second part of it, and I said, okay, I'm gonna come back and answer that other part, but I had forgotten to answer that other part, and she pointed out that I hadn't answered the other part. So thank you, because then I was able to go back and add those additional slides to fully answer that question, because it was just that, a complex question. So
it was.
Yes. I'm just so grateful for the two of you, because there's things that I've always wanted to know about animals. I love them so much, but I didn't have the stomach or the courage to do what you ladies have done in this field. And so I just appreciate both of you so much. And thank you again for this just informative presentation. And I can't wait for us to present it to our community.
Thank you so much for having me again. Really appreciate you both, and had an awesome time. And you guys have a good one. I'll see you next time.
All right. Thank you.
Thank you, both of you ladies. And you guys, please pay attention to our contact information. We will also be sending it on the recap. And ladies, have a phenomenal day and weekend.
You
too. You as well.
Bye.
Bye.
Okay. Bye.
Oh.